The Able to Care podcast is sponsored by Able Training Support Limited, who build partnerships with organisations to develop confidence and competence in their team to promote positive outcomes for all. Find the link in the description. Hello and welcome to another episode of the Able to Care podcast. I'm your host, Andy Baker, and today I'm going to do it on a topic that I've been delivering for a number of years now. And the reason that I've decided to do on this topic is because I was talking to somebody the other day who'd experienced a very similar situation to one that I witnessed within my own family. So for some of you out there, if you are paid caregivers, especially in adult, elderly, or supporting those with physical disability, will immediately cringe or potentially switch off as soon as I say the phrase moving people safely or manual handling or moving and handling of people. But the reason I decided to talk about this particular topic today is because I was talking to somebody who'd experienced some difficulties and challenges with supporting their loved one who was of older age, as far as getting them in and out of chairs and getting them in and out of the car and things like that. And it's one of the things that I found when my mum was supporting her mother. I attended a funeral. We all went to a funeral, and it was my sister, my mum, and my gran, and myself were all there. And my gran was sat between my mum and my sister. And because it was a funeral, my gran's mobility was deteriorating. But because it was a funeral, there was a lot of standing and sitting within the church. And my gran was struggling to get up and to sit down safely. So my sister and my mum were both trying to help her. But they were helping her using a technique that some of you in the care sector will know is called the drag lift. The drag lift is a technique that's been described as, or it's been classed as unsafe or bad practice, I think since 1981 within the professional care sector. So, and many of you who are unpaid caregivers may have absolutely no idea and have never heard of it. So that's what we're going to talk about a little bit, about manual handling practice and why that particular technique was classed as unsafe and why moving and handling is important. In professional care, especially with CQC registered organizations, if the moving and handling or moving and positioning of people is required, the staff are recommended to have annual refresher on this particular subject. So for many of them out there that have done this training, they have to do it every year, and therefore it feels like a slog that they have to every year. And this is where I've been delivering this course for a long time as well. But I actually like the course. It's one that I find quite beneficial when I go and teach it. Obviously, one of my big things is trying to change mindset, to get people to think about what they're doing, to create a little bit of cognitive dissonance. I think moving and handling is one of those subjects. So let me explain a little bit. One of the reasons that moving and handling or moving and positioning of people, there's lots of different terms that have been used for it, is recommended to be delivered annually within professional care and elderly care sectors, is because it's one of the biggest risks to what staff do. There is a risk to those being supported. If we are moving and positioning a person, obviously that is where accidents could happen, things could go wrong and injuries could occur. But also it's for the actual well-being of those that are doing the supporting, those that are caregivers. That moving and handling or manual handling is, I think, the second biggest cause of workplace ill health within the UK, that causes people to be off work through back problems or work-related upper limb disorders. But it's also one of the biggest causes of accidents as well. So slips, trips and falls, I think, is number one, but manual handling or moving and handling musculoskeletal injuries is up there as far as injuries are concerned. So it is a significant concern for all of those working within that sector for keeping themselves safe. So that's why it's recommended annually. And a lot of people go, why do you have to do this annually? Well, things change. Well, not a lot changes, but it is because it was one of the biggest risks. I try and get over that moving and handling is not something that we only do at work. It's something that affects our day-to-day life, that from the moment we get up in the morning, we are moving and handling, we are utilizing our back and our muscles. And so straight away, that these situations could occur at any time in the day. But it also is something that could affect your everyday. If I do hurt myself at work, then suddenly that may affect certain hobbies I do, being able to look after myself, being able to look after others, significantly impacted. Now, for those of you out there who do look after a loved one and support and care for a loved one, if your moving and handling is bad, you're trying to support a person, yes, there is a risk. You could hurt them if you do it incorrectly, but there's also a significant risk to you. And if you injure yourself, well, who looks after them tomorrow? How's that going to affect your actual job that you're trying to keep at the same time as caring for your loved one? How's it going to affect your ability to look after your children? So I try and get over that manual handling is actually quite an important topic. Back care is a 24/7 thing. And maybe it's because I have had some back problems and stuff that I know it's affected me, that I'd rather nobody else experience similar challenges. So this isn't going to turn into a manual handling class or anything like that. Although we are going to be, when the ablehub.uk is up and running, there will be videos on there available for paid or unpaid caregivers to know how to potentially do moving and handling correctly, moving and positioning correctly, just as a resource. For those who are in the industry, they can use it as a bit of a refresher. For those of you out there who don't get training in this kind of topic, as well as the free courses that are available on the hub, there is also going to be some videos to kind of at least give you an idea of what you should be doing. Because that's exactly what I did, is I taught my mum how to help my gran out of a chair using safe practice, using safe methods. Let me just talk a little bit about this, what's called the drag lift. So the drag lift basically involves any transference or moving a person that involves hooking underneath their arm. Now, hooking underneath the arm is one of those, helping a friend off the floor, carrying a drunk friend or anything like that. We often use that position to support a person. There isn't many handles on the human body. This is one of them as far as that shoulder's concerned. The problem is it isn't a great handle in so much as it's a vulnerable part. The easiest bone to break in the human body is actually the clavicle, okay? May worry why I know that, but I'm a long-time martial artist as well, and I learned that in martial arts, the scapula is the hardest bone to break, and the clavicle is the easiest bone to break. So I think that's not including toes and fingers and things like that, though. But yeah, so I teach first aid and I teach martial arts. It's I know how to break them and how to fix them. But within moving and handling, yeah, this is a vulnerable part of the body. There is a danger, obviously, that part. And I have a friend who used to work as a domiciliary carer who's one of his clients, he wasn't there for a week, but other carers did this. One of the clients was actually had their shoulder dislocated from being drag lifted up the bed. And they're the two common movements that people do using the drag lift, helping a person get out of a chair and transitioning either to walk them or to another chair or to a wheelchair or to the toilet or in and out of a car, or they do it to move a person and reposition up the bed to sit them up. So we just said this is a vulnerable part of the body, but it's also something we have to consider as far as the risk to the caregivers. I always kind of get over that it's much easier to carry a shopping bag in each hand than it is to carry two shopping bags in one. The weight's the same, but that pulling on one side puts a lot more pressure, feels more uncomfortable, and we're more likely to injure ourselves because we're not spreading the weight. So if I'm hooking underneath a person's arm, that is leaving me quite vulnerable as far as my shoulder's concerned, my arm's concerned, and potentially taking their full weight. So many of you out there may have done moving and handling practice. You know the kind of golden rules of keep your back straight, which isn't technically correct, but you should keep your back in its natural position, stable base, bend your knees, don't twist, keep the load as close as possible. These are your kind of your golden rules that any manual handling, whether moving a box or moving a person, should apply. And a good manual handling technique allows us to follow those golden rules. So the drag lift straight away doesn't work to help the caregiver on this because it's putting all weight on one side and they're not usually able to position and posture themselves to be safe. They're bending their back badly. They're not able to bend their knees. The other problem, it doesn't ever allow the individual to do their natural movement. So typically, if you guys are, obviously don't do this. If you're listening in the car, don't act this out now. But if you are sat in a chair, this is an exercise I do when I'm teaching people. I get them to write down the steps of how you get up out of a chair and just break it down into a step-by-step process. And then I act it out. And usually the instructions they give me are not quite as specific as they need to be. So they kind of just, well, you just straighten your legs. But if I just straighten my legs, I'm going to throw myself over the back of the chair. So there's a lot of actions I actually do. And when I'm teaching this, I get people to think about, if I was teaching somebody, let's say somebody with an acquired brain injury, they had to relearn how to stand up, something we take for granted. Well, then you need to break it down into stages of how they actually do that. How do we teach somebody to stand up again? Because I guarantee if I just said, right, you need to stand up, all of you just do it. Okay. So being able to break it into stages is quite important. And this also helps us to understand the mechanics of how a person would do it for themselves. Feet on the floor. The big thing is, we move to our bottom towards the edge of the chair, depending on the chair. We place our hands on or something to push on, whether that be our legs or the arms of the chair. And the big thing is we bring our heads forwards over our feet, and then we push up through our legs, driving and straightening our body as we go. When we sit back down, we do the same thing in reverse. We kind of start reaching down for the chair, or we kind of start bending forward slightly first, bringing our bums back. And then the head is the last thing to come back into the chair. Okay. So we bring our head forwards over our feet to stand up. And the last thing to move back is our head again. Now, something like the drag lift, where I'm stood in front of somebody and hooking underneath their arm, completely inhibits their ability to be able to do that. So that puts a lot of pressure on my back because it's bad positioning, but it also means that they can't do the movement they naturally would. So this is exactly what happened with my mum, my sister, and my gran in the church. Every time they tried to get her up, they were hooking underneath her arm. They were trying to stand up and pull her up. So they were trying to get her without being able to bring her head forwards to just basically just lift. And what was happening is that her legs wouldn't support her there. So she was then dropping back down. And because they had her supported underneath one arm, they were being pulled down with her. So she was falling back into the chair, but my mum and my sister were also being pulled down onto the chairs as well. And they kept falling down. It was just, it was a bit of a noise, it was a bit of a mess. There was people looking over, not the best thing to be happening at a funeral to draw attention to ourselves. So doing proper manual handling technique, there is a skill, there is a way we can do it that reduces the risk to the people doing the movement, but it also offers the least risk to those who are actually doing the movement. The general golden rules is good manual handling practice. Okay. We should never be taking a person's full weight. And that's also another big factor. And that was what was happening because my grand's legs were going out from underneath. She couldn't lock her legs out. She couldn't stand properly. There's that vulnerability. Straight away, then the full weight was going on my mum and my sister. And that was increasing the risk to them. So we shouldn't hook underneath because if something happens, they fall, full weight being taken. The last thing, it should allow the person to do the movement they naturally would anyway. So when I'm teaching moving and handling techniques or moving, repositioning people techniques, I kind of go through the how we actually do it, and then we kind of then figure out the technique from there, as well as obviously following. I didn't make up the techniques. These are approved and they kind of then work. What I find in a lot of care settings, though, is obviously there is numerous bits of equipment out there. And if you are struggling with your manual handling, please, speak to social services, make sure you get in contact with somebody, go, I'm struggling to do this on my own. I'm worried about hurting them. I'm worried about hurting myself. Please, can I get some assistance? And that's where we get an occupational therapist in to come and do an assessment to kind of then go, okay, this is the equipment the individual needs, or this is the way that we could go move forwards with this. You have to kind of push forwards that you need these things rather than just struggling on your own. And this isn't always as well, elderly. I teach this course a lot in elderly settings, but it could also be individuals with physical disability. An occupational therapist, there's loads of equipment available out there to allow repositioning for or transfers or whatever we need. There's an amazing amount. And obviously, as technology moves forwards, there's more stuff that will kind of do it for you or electronically rather than having to physically and manually kind of do it. So many people know what a hoist is, for instance, and there's a few different variations of hoists out there. So you've got your mobile hoist, which are the ones that are on wheels. You've also got then what we call gantry hoists, which is kind of a fixed A-frame that kind of slides across. That you can use, or you've got your ceiling track, which are ones that are actually fitted into the ceiling to be able to assist with moving and handling as well. And I've been to some people's homes where there's some amazing ceiling track hoists. There was one where I was teaching manual handling within to a family and to this lad's caregivers as well. And he had a ceiling track hoist that took him from his bed, and he could control it himself as well. So once they helped him into the sling and he could lift himself up, he could like actually move along the gantry hoist, take himself to the toilet or take himself into the shower as he wanted to. So he had a lot of autonomy and a lot of control over his own care and his own movement once he was supported into the actual hoist itself. So recommendations then. If you are caring for a loved one and you've never done any moving and handling, there is some online courses out there that you can do at least to give you some idea of good practice. Or you can obviously request and get some information from your occupational therapist or speak to whoever supports you as far as your social care, social worker, to see what additional support and help that you can get. For those of you who are in the caring profession and have to do this refresher training every year, one of the things I'm going to try and sort of reiterate is I bet after any moving and handling training course, your practice is really good. But I'd probably give it a half hour of you being busy and you'll fall back to old practices. We only tend to worry about our moving and handling when something is perceived as heavy. So if I'm picking up furniture or moving a heavy box, I probably think about it more than I do if I'm just kind of picking a small box off the floor, for instance. I might just lean over and grab it without really thinking about it. But it is so important when we are doing the moving and handling or moving and positioning of people that we bear in mind that one thing that makes it higher risk for moving people is that people can be unpredictable. People will struggle in a moment and lose their footing. They will become potentially uncoordinated or difficult in that moment where they're being slightly, or maybe they're slightly anxious and therefore may grab hold. And that's where there is risk. So having good practice when it comes to your manual handling significantly reduces the risk for yourself as well for those that you care for. The last point I'll also mention, and maybe this is one we could put in the chat and have a conversation about. Most care settings have a unhindered drop policy or an unhindered fall policy now related to a falling individual or a falling client, falling resident. This is where there's controversy because the instinct is to try and catch, try and protect, try and make them safe. So I often have this conversation of who do we have a duty of care to first? And the answer should always be ourselves. Whether you are a paid or an unpaid caregiver, teacher, parent, doesn't really matter. We have to have a duty of care to ourselves first, because if something happens to us, who's going to look after that person tomorrow? So although we should always try and minimize the risk as much as we possibly can, if a person is falling to the ground, if we try and catch them, we're probably more likely to cause them injury because of where we grab them and how we inhibit their ability to naturally keep themselves safe by putting their hands up. Well, the instinct's probably going to be to grab their arms to stop them from falling. So you've inhibited that. But also then you get yourself hurt, injured, which means you can't offer them assistance, or you fall on top of them, and nobody wants that either. Hopefully you found this little podcast, a little subject, is a little bit different from what I usually cover around the kind of the behavior side, but I think it's something that's really important for both paid and unpaid caregivers. I taught my family how to do moving and handling to reduce the distress for my gran, as well as the distress for them for situations exactly like that, to help her up out of a chair. We also then, invested in some, she had a recliner, then lifted her up rather than having to get out of it herself. And there was lots of things that we could add into her life to promote her independence, to allow her to maintain in her own home or stay in her own home for as long as she possibly could. But also to keep family members and people safe at the same time. Any questions, any comments, please pop them in, like and share. Cheers.